First aid is the help that you can give a person who is injured or suddenly falls ill. The aim of providing first aid is to preserve life, to prevent condition from becoming worse and to promote recovery. Note that immediately after you find an injured victim, call for help or call the ambulance. Only after which you may start the first aid procedure. First aid procedure is applicable in various health emergencies that you may face in your workplace. The below are some of the common emergency situations: cuts, wounds and bleeding, joint dislocations, sprains, fractures, head injury, eye emergencies, heat illness and heat stroke, toxic gas inhalation and oxygen deprivation, seizures, that is fits, burns that includes hot burns, cold burns and electrical burns, snake bites and insect bites, dog bites and eagle bites, choking, electrocution. These emergency conditions are caused due to various occupational situations such as road accident while riding a vehicle, fall from height, that is from a tower, scaffold or building, equipment or tool falls from height, falling of foreign body in ice, heat stress due to excessive sun exposure, electrical shock or electrocution, chemical splash on ice, toxic gases inhalation or oxygen deprivation exposure, entrapment in a trench collapse, cut injury while using sharp tools, fire burns or electrical burns or cold surface burns, insect or snake bites in the work area, dog or eagle bites in the work area. All the above emergencies have the potential of becoming a fatal incident if not treated properly at right time. After watching this video, we will understand how to react and provide proper first aid during the above mentioned emergencies. Before understanding the detailed procedure, we need to be familiar about the contents of a first aid box. The first aid box contains cotton to place it over the injured part to stop bleeding, roller bandage both small and big to cover the wound and prevent from further bleeding, gauze pads to place it over the injured part to prevent bleeding, triangular bandage, standard size. It is used to firmly place the fractured or dislocated part without motion. Sterile eye pads to place it over the injured eyes and cover it. Splints. These are small wooden sticks which is used to support the fractured part to be immobilized. ORS, oral rehydration solution. Mix it with water and give it to the person who is dehydrated. Antiseptic solution or powder to clean the wounded area from foreign body and other bacteria and viruses. Crepe bandage to roll and tie around the sprained, dislocated or fractured area. Burnol to apply on the wounded area due to burns. Swab to clean the wounded area by applying antiseptic solution on it. Band-aid to cover the small wounds. adhesive tape to support the roller bandage and cotton to be intact on the wounded surface. Scissors, useful in cutting the roller band-aids, adhesive tapes, etc. The first aid box shall not contain any medicines or tablets. It is always recommended to maintain a list of items in the first aid box as shown, which includes the expiry date and quantity of the items. Now, we will understand how to provide first aid for each of the emergency conditions. First aid for cuts or wounds or bleeding. For mild cuts and wounds, wash the wounds and abrasions with clean running water until the wound area is clean from the signs of foreign matter. Apply antibiotic cream or liquid or powder to superficial wounds. Our aim is to prevent infection and aid in fast wound healing. In case of a large wound and heavy bleeding, do not wash the wound but control the bleeding by placing the gauze pad tightly. Apply direct pressure and elevate the injured part to prevent the blood loss. Our aim is to prevent blood loss and reduce shock. Immediately take the victim to hospital for further management. First aid for joint dislocations. Advise the casualty to keep still. Use the splints to support the injured part so that the part is immobilized. Check the blood circulation beyond the bandages every 10 minutes. Do not try to reposition a dislocated bone into its socket. Seek medical assistance immediately. First aid for sprains. One of most common injuries in outdoor activities is sprains. A sprain is defined as the stretching or tearing of ligaments, the tough bands of fibrous tissue that connect two bones together in your joints. Symptoms include pain at the joint, swelling, redness and difficulty in movement. The treatment for sprain is RICE protocol. R. Rest. I. Ice application. C. Compression bandage. E. Elevation of limb. First aid for fractures. Fracture is a break or crack in a bone. You can identify fractures by observing deformity and swelling, pain and difficulty in moving the area, bending or twisting of bones, a wound with bone end protruding outside the skin surface. There are two types of fractures: open fractures and closed fractures. For open fractures, carefully wrap the fracture and stop the bleeding. Carefully place clean padding and splints over the area and loosely cover it. Secure the dressing and padding with a bandage. Immobilize the fracture site. Seek medical assistance immediately. For closed fractures, advise the casualty to keep still. Support the injured part with padding and splints and wrap the fracture with bandage. Immobilize the fracture site. Seek medical assistance immediately. Now we will see few practical immobilization techniques for fractures. Upper arm. The shown item is the triangular bandage. You can use this or even use a long cloth or towel, whichever is available. Use it as shown in the demonstration. Balance the injured part and tie it as shown. Forearm injury. Use the splints as shown to make the injured part immobilize. Use the roller bandage to wrap the splints firmly and tightly as shown. Wrist injuries. This is the wrist drop injury. Grab the hands gently as shown and roll the bandage firmly and tightly as shown. Finger injury. For finger injury, use the smaller splints as shown to make the injured finger immobilized. Roll the bandage over the splints as shown. First aid for head injury. If the head injury is severe, call the ambulance immediately. If the injured person is bleeding, try to stop the bleeding by using gauze or a clean cloth. If the wound is open, do not touch or apply pressure on it. Cover or wrap the wound with a clean piece of gauze, that is, bandage instead. Look out for warning signs like loss of consciousness, ear, nose or oral bleeding, nausea and vomiting. Do not give anything to eat or drink. If the person is awake, instruct them not to move their head and neck. This can help prevent further damage to their spine and brain. If the person is unconscious and breathing, try to stabilize their body. This includes keeping their neck and head in line with their spine. If the person is unconscious and not breathing, begin the process of CPR, that is, cardiopulmonary resuscitation. First aid for eye emergencies. Eye emergencies are caused during a chemical splash over the eye or a foreign body impact in the eye. When foreign body hits the eyes, do not rub the eye as it will make the situation worse. Never try to remove the object by yourself. Perform repeated eye wash with clean water. Splash the water in the eyes continuously. Cover the injured eye with a clean pad and bandage. Take the victim to the hospital. Heat illness or heat stroke. It is always advised to drink enough water and keep your body hydrated. In tropical and hot climatic conditions, the excessive heat causes heat cramps, heat exhaustion and heat stroke, which can be fatal. For heat cramps, drink water immediately. Move victim to a cooler place to lie down. Drink ORS, oral rehydration solution. Remove or loosen the clothing. Cool the skin with water by gently spraying or sponging. Wrap in a cool wet sheet or put in a cool bath or shower, only if patient is conscious. Burns that includes hot burns, cold burns and electrical burns. Cool with water for 10 minutes. Remove loose dressing. Do not cover face. Seek medical attention. Don't touch the burn. Don't burst blisters. Don't remove sticking clothing. Don't apply fluffy materials on burn area such as wet flour, ink, etc. Apply burn-all lotions or creams. First aid for choking. Back blows. Behind the person, forward and deliver up to 5 firm blows between the shoulder blades. Abdominal thrust. Place your fist just above the belly button. Give up to 5 quick inward and upward thrusts. Toxic gas inhalation or oxygen deprivation. Take necessary precautions to protect yourself from the toxic gases before trying to save the injured person. Place a wet cloth on your nose and mouth. Move the victim to a ventilated area and allow fresh air. If the victim vomits, place him on one side to prevent suffocation in the recovery position. If the victim is unconscious but breathing, place them in recovery position. However, if the victim is unconscious and not breathing, start performing CPR. Seizures, that is, fits. Stay calm and immediately call for medical help. Move away the surrounding furniture or any other objects around them. Do not hand over keys to stop the seizures. Do not put anything, including your fingers, into the person's mouth. Do not try to control the person from seizures. After the seizures, check the person for injuries. Roll the person to recovery position. If the person is having trouble breathing, use your finger to gently clear the mouth. Loosen tight clothing. Make the person to rest. Do not give the person anything to eat or drink. Stay with the person until he or she is awake. Snake bites or insect bites, bees or wasps. The 4 main venomous snake species of India are common krait, Russell's viper, Indian cobra, saw-scaled viper. In case of snake bites, don't panic. Keep the victim motionless or immobile as far as possible. Call the emergency number immediately and seek medical attention. Remember, 70% of all snakes are non-venomous. Only 50% of bites by venomous species poison the victim. Snakes bites only when provoked in defense. Wear proper PPEs like safety shoes, helmets when working in snake-infested areas. Perform carry no right. Carry the victim to hospital. Do not allow victim to walk even for a short distance. No tourniquet. No electrotherapy. No cutting and pressure immobilization. R. Reassure the patient constantly. I. Immobilize the victim in the same way as a fractured limb. GH. Get to hospital immediately. T. Tell the doctor any systemic symptoms that manifest on the way of hospital. Do not waste time for doing the first aid management. Only if it is possible, remember the snake or insect type. All government hospitals will treat snake or insect bite. In case of insect bites, bees or wasps, do not try and squeeze the stinger out, as this will cause more bee or wasp venom into the skin. Try removing the stinger with tweezers, or use clean sharp objects like scissor or blade to scrape off the stinger. Apply a cool washcloth or ice pack. Some people have symptoms of severe allergic reactions as shortness of breath, thickening of the tongue, sweating, and anaphylactic shock. Seek medical help immediately. Dog bites or eagle bites. Place a clean towel over the injury to stop any bleeding. Wash the bite carefully with soap and water. Apply a sterile bandage to the wound. Reach to a hospital immediately to get proper treatment. Electrocution. Burns can occur due to electrocution. Burns are mostly exposed to soft areas, hands, feet, armpit, chest, face, joints and genitalia. All electrical burns are dangerous. It can interfere with our heart's electrical activity. Be prepared to perform CPR as per basic life-saving protocols if needed. During rescue, remember to be safe at first. Ensure the power source is switched off or the person is not in contact with any live power source. Basic life support or BLS generally refers to the type of care that first responders, healthcare providers and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress or an obstructed airway. It requires knowledge and skills on using the first aid kit to provide immediate first aid, recovery position, DRCAB and cardiopulmonary resuscitation, CPR. Recovery position. When the patient is unconscious but has a steady pulse, we should make the victim to roll into the recovery position. Grab left hand and place it below the head. Cross his left leg as shown. Grab right hand and roll the person to his left side as shown. You can check the pulse in the hot spots like wrist and neck. Or the easiest is to place your ears on the person's chest to hear the heartbeat. DRCAB. D. Danger. Check the dangers before touching or starting to rescue the victim. R. Response. Shake the victim gently and shout. If the victim is unconscious but has pulse, make the victim to roll into the recovery position to prevent blood clots or vomiting. If the victim is unconscious and has no pulse, immediately start performing the cardiopulmonary resuscitation, CPR. Cardiopulmonary resuscitation, CPR.
Now, let us see how to give CPR. take your dominant right hand, place it on the center of the chest on the sternal bone, which is in the center of the two nipples. Take your other hand and place it on the dominant hand and interlace your fingers. Now, push hard and push fast at least 100 to 120 compressions per minute, like this. In adults, when we are performing CPR, for every 30 compressions, we used to give 2 rescue breaths. Now, while performing the CPR, we have to remember some important points, or else the quality of the CPR will be drastically reduced. First thing is, when you are giving chest compressions, your elbows must never bend. It must always be straight, like this. Second, when you are giving the CPR, you have to allow the chest to recoil completely, like this. When you are giving CPR, the pressure of the CPR must always start from your hips to your shoulders, to your elbows and to your wrist. Last but not least, when 2 persons are available to give the first aid, one can give compressions, other can give rescue breath. But when only one person is available to give first aid, you can always give compression only CPR, that is only chest compressions alone. No need to give rescue breaths.
We have seen all types of occupational emergencies for the employees of Tata Communications in their work sites. Always know the emergency contact numbers of your locality. Properly communicate the first aid emergency conditions both to the emergency center and ambulance and also to the supervisor. Take a note of the various emergency contact numbers of all the states of India. Watch this video and get refreshed about the recommendations, as it is very important and life-saving. Learn first aid. Save precious life. Thank you.